I'm really excited about a lot of these approaches as a fertility specialist.
So from a least invasive to most invasive, uterine artery embolization, I would say, is a procedure. It's not surgery at all. You don't have to go under what's called general anesthesia. And that's when an interventional radiologist, not a gynecologist like myself or Dr. Tiffany, will place pellets in the vessels that feed the uterus and therefore feed the fibroids and cut off that blood flow. And the fibroid will die off over time. The advantage of that procedure is that it is non-invasive. There's no cutting. You usually can go home the same day or the very next day, and recovery is about 1 to 2 weeks. The con is that if you have a desire for fertility, sometimes it can affect fertility because you're cutting off blood supply to the entire uterus, not just the fibroids.
If I was going to do something like an embolization, I would go for a UFE over UAE, or the artery versus the fibroid versus the artery, because it's likely going to be less detrimental to the uterus itself.
You want to break down the difference between UAE and UFE?
Yeah, so they're performed by radiologists, but uterine fibroid embolization is newer, and it really is targeting the very small vessels that are connected to the fibroid themselves. So hopefully that will come more into development where fertility is an option. When you block arteries, like the uterine artery for uterine artery embolization, you are affecting the entire uterus. But uterine fibroid embolization, you're being more specific and more controlled, and they're not really proven for fertility. So I do exercise caution for any patient who is thinking about doing it.
And the other con is that it's painful. You usually will need Percocet, something. You'll need some narcotics to get through the pain of the shrinkage of those fibroids because that tissue is dying.
And the other thing I think we want to make sure women are aware of is in that procedure that the particles can get dislodged.
Yes.
Cause damage to other organs and just other damage in the body.
And when you speak with that IR specialist, ask them about selective UFE, because there are many IR specialists that UFE and UAE are exactly the same. But you want to be specific, and that you want to say, do you perform a selective embolization or a selective uterine fibroid embolization that's going to target more so just the vessels that are feeding the fibroid instead of the entire uterus? Not everyone does that. Then there's something called MRI-focused ultrasound, which is not very popular yet. It's not on the market, commercially available or covered by insurance by most. It's being researched, but it's out there. So if you Google it, we want you to know that what you're hearing on Google is not a lie. They're working on that intervention. There's also an endometrial ablation, or burning of the lining of the uterus. I mentioned this because NIH has it listed as an option for fibroid management. Hear me clearly, it is not an option for fibroid management. It does not treat fibroids. It burns the lining of your uterus. One, you can't do it if you desire fertility. If you're done with fertility, it's an option to maybe decrease the heaviness of your bleeding. But if you still have fibroids that are untreated, it usually won't last very long. That one might fail, but it's an option. And then there's radiofrequency ablation, which can either be done hysteroscopically through the cervix, through a camera where the fibroid is not removed, but a needle is placed into the fibroid under ultrasound guidance to heat up that tissue. Different than cutting off the blood supply, but heating up that tissue and allowing it to shrink over time. And then there's a laparoscopic approach, which is my favorite approach, to do the same intervention, radiofrequency energy through a needle, heating up the fibroid under both laparoscopic, a camera in your belly, and ultrasound, also in your belly in real time, looking for all the fibroids. When we heat up that tissue, that fibroid cells are destroyed and the fibroid will shrink over time. It's a slower process, but patients go home the same day. They're back to work in a week, back to exercise, activity, sex in 2 to 3 weeks. It's a quicker turnaround. They use Motrin. No Percocets required. And then there is, again, laparoscopic and robotic approaches or vaginal approaches to a myomectomy and a hysterectomy, which we talked about earlier.
I'm really excited about a lot of these approaches as a fertility specialist. I do have to caution that we don't have a lot of information, though there are case reports for all of these minimally invasive techniques. And as we get more comfortable and more people have these procedures, we'll hopefully get pregnancy data to just give people other options than these very invasive and risky sometimes surgeries that we think are the mainstay of treatments for women who desire future fertility.
Talk to your GYN, talk to your reproductive specialist, talk to your interventional radiologist. Second opinions are a thing.
Second opinions are a must.
I mean, yes. You want second opinions on it.
Yes.